Ready to dive into something pretty incredible? We're talking AI in healthcare and how it's changing everything. Not in some sci-fi future, but like right now.
It's happening fast, too.
Yeah, absolutely. So we're going to unpack this research article. It's called Application of Artificial Intelligence-Based Technologies in the Healthcare Industry, Opportunities and Challenges. It's from the International Journal of Environmental Research and Public Health.
And it's packed with real-world examples, which is what we're going to focus on.
Exactly. Real stuff happening right now. So what does this expanding use of AI actually look like in healthcare? What does it mean for, you as a patient or anyone interested in, like, the future of medicine?
Twin questions.
Huge. Okay, so the article kicks off by defining artificial intelligence.
Okay.
It says, the simulation of human intelligence in machines programmed to mimic learning and problem solving. Pretty straightforward. But it's not that simple, right?
Right, because AI isn't just one thing. It's this umbrella term. Think machine learning, deep learning, those are all under the AI umbrella.
So, like, AI is the big concept, and then you've got these more specific types within it.
Exactly. Like machine learning is all about algorithms that can learn from data. And then deep learning, that's a type of machine learning inspired by the structure of, get this, the human brain.
That's wild. So these different types of AI, how are they actually being used? Like, give me some real-world examples.
Okay, how about this? Diagnostic assistance. That's a huge area.
Okay, diagnosis. Yeah, I've heard about that. Like, AI helping doctors make diagnoses.
Right. And the article highlights this amazing case, Moorfields Eye Hospital in London. They developed an AI system that can diagnose over 50 eye diseases.
50. Seriously?
Yep. And the accuracy, 94%.
That's insane. So it's basically as good as or even better than human experts.
Basically, yeah. And think about the implications.
Okay, what implications?
Imagine eye diseases being caught way earlier,
Right.
like potentially saving people's sight and, reducing healthcare costs, too.
Right, that makes sense. Early detection is always key.
Exactly. And this tech could completely change how ophthalmologists do their jobs. They can focus on the more complicated cases, spend more time with patients.
Wow, that's a huge shift. It makes you wonder if this kind of technology will, like, become as routine as a blood test someday.
Right. It's fascinating to think about.
Definitely. But, okay, the article also mentions some less successful cases, right? Yeah. Reminds us that AI isn't this, like, magic bullet that always works perfectly.
Oh, yeah, for sure. It's not all sunshine and roses. They talk about IBM's Watson for oncology. It was a big deal a few years ago.
I vaguely remember hearing about that. What happened?
Well, it turned out that Watson's treatment recommendations didn't always match up with what the doctors thought was best.
Like the AI and the humans disagreed.
Yeah.
Yeah.
For rectal cancer cases, there was like an 85% consensus, but then for lung cancer, only 17.8%.
Whoa, that's a huge difference. Like, why such a big gap?
That's the thing about AI. It learns from data. If the data is incomplete or biased, well, the results can be off.
So the quality of the data is crucial.
Absolutely. And that's why we need diverse representative data sets when we're developing these AI systems. Otherwise, we could end up with AI that actually makes healthcare inequalities worse.
That's a scary thought. It's like AI can be a powerful tool, but it needs to be used carefully.
You got it.
Okay, but AI in healthcare, it's not just about diagnosis, right? There's more to it than that.
Yeah, tons more.
Yeah.
Like, think about all the nursing tasks and managerial stuff. AI can play a role there, too.
Oh, yeah, like automating some of the more tedious tasks.
Exactly. So healthcare professionals can spend more time actually caring for patients.
Makes sense. And the article gives some cool examples of that, right?
Oh, yeah. Like, the Cleveland Clinic is using Microsoft's Cortana to help identify at-risk patients in the ICU.
Oh, wow. So using AI to kind of predict which patients might need more attention?
Yeah, pretty much. It analyzes all sorts of patient data in real time.
Real time. That's incredible.
Right. It could be a total game changer for patient safety.
And then there was that example, I think it was in South Korea, with the robot.
Paul.
Yes, Paul. It's like he shadows doctors on the rounds and uses voice recognition to transcribe everything.
Saves so much time on paperwork.
Right. It frees up doctors to actually focus on, like, interacting with patients.
Exactly. Makes the whole experience better for everyone.
Okay, so we've got these specific examples, but the article also talks about the bigger picture, right? Like the overall opportunities that AI presents for healthcare.
Oh, yeah. They lay out a whole bunch of them. Improved treatments, more patient engagement, reducing errors, making things more efficient, boosting productivity.
Wow, so many. It's like AI has the potential to touch every part of the healthcare system.
Pretty much.
And one of the things that really stood out to me was the idea of personalized preventive care. Like using AI to help people stay healthy and, maybe even prevent chronic diseases before they develop.
Yeah, that's a huge one. And the article mentions ABI research. They're predicting a massive increase in the use of AI-powered devices for exactly that, preventing chronic diseases.
It's kind of mind-blowing, right? Like using technology to actually prevent illness instead of just treating it after the fact. Do you think that's realistic?
I think it definitely could be. We already have wearable devices and apps that track your health data. Imagine that, combined with powerful AI algorithms that can analyze that data and provide personalized recommendations.
It's almost like having a virtual health coach in your pocket.
Right. But of course, we need to make sure these tools are based on solid science,
Mm.
that they're accessible to everyone, and that they actually work in the real world.
Yeah, for sure. It's exciting to think about the potential, but we also have to be realistic about the challenges.
Absolutely.
And speaking of challenges, the article definitely doesn't shy away from those. There's a whole section on the potential downsides of AI in healthcare.
Right, right. It's not all like AI will save the world kind of stuff.
So, what are some of the big concerns they raise? Like, what are the things we need to be careful about?
Well, they talk about the possibility of AI systems making errors. And then, of course, cybersecurity and keeping patient data private is a huge concern.
Hmm.
And there's a whole issue of jobs, people worrying about AI replacing human workers. And then there are the ethical considerations, like making sure AI is used responsibly and fairly.
So, it's like there's this immense potential for good, but we also have to be really careful about how we develop and deploy AI. We need to make sure it benefits everyone, not just a select few.
Couldn't have said it better myself.
It's definitely a lot to think about.
It is. It's a really complex issue. But I think it's important to be having these conversations now so we can shape how AI is used in healthcare.
I totally agree. We can't just wait and see what happens. We need to be proactive.
Exactly. And that's what's so great about this article. It's not just about the technology itself. It's about thinking through the implications, the good and the bad.
Right. It's like AI is this powerful tool, but it's up to us to decide how we want to use it. And I think that's a good place to wrap up this first part of our deep dive.
Agreed. There's a lot more to unpack, but we've laid some good groundwork.
We were talking about some pretty big challenges with AI and healthcare. And one that really got me thinking is, like, who's responsible when things go wrong?
Accountability, yeah.
Yeah, exactly. Like, what if an AI system makes a mistake, a misdiagnosis or something, and it has serious consequences for the patient? Who takes the blame?
That's the million-dollar question.
It's tough, right? Because you've got the doctor who's using the AI, the hospital that implemented it, the company that developed the AI in the first place. Like, where do you even start?
The article points out there's no easy answer. It's this legal and ethical gray area.
A gray area. That's a good way to put it. It seems like a total minefield.
It kind of is.
Yep,
They
yeah.
suggest like a multi-pronged approach. First, we need clear regulations, like specific laws for AI in healthcare.
So almost like rules of the road for AI.
Yeah, exactly.
Yep.
And then rigorous testing, really putting these systems through the ringer before they're used on actual patients to minimize the risk of those errors happening in the first place.
Okay, that makes sense. But even if you have the perfect AI, there's still the human factor. Like, doctors and patients need to understand how to use this information responsibly, right? It's not just blindly trusting whatever the computer says.
Right. It's not about replacing human judgment. It's about supporting it.
Exactly.
And that brings up this other challenge. The article calls it the AI divide.
The AI divide.
Yeah, like some people just aren't familiar with AI. They don't understand how it works, so they might not trust it.
Like, they're just not comfortable with the technology.
Exactly. And that can be a big barrier to using it effectively.
It makes me think of how people were, like, scared of the internet when it first came out, just because it was new and different.
Totally. It's the same kind of thing. So we need to do a better job of explaining AI.
Yeah.
Make it less mysterious, be clear about the benefits, but also honest about the limitations.
Transparency is key. Okay, so we've got this, like, trust issue, this AI divide, and then there's also the whole thing about cybersecurity, data privacy. That seems like a huge concern when we're talking about people's medical information.
Oh, absolutely. That's a big one.
Yeah.
The article really stresses the need for super strong security measures.
Like, what kind of measures?
Well, things like encryption, controlling who has access to the data, but it's also about having clear rules about who owns the data and how it can be used.
Right, so patients have control over their own information.
Exactly.
But even with the best security, there are always going to be people trying to, like, hack into systems, right?
Unfortunately, yeah, that's the reality. So we always have to be one step ahead, always updating our defenses. It's a constant battle.
Sounds exhausting. Okay, let's shift gears a bit. The article also mentions job displacement. The idea that robots are going to take over all the jobs. It's a common fear when people talk about AI, right?
Yeah, it comes up all the time. But the article suggests that AI's impact on jobs is more nuanced than that.
So not just like robots are taking over.
Not quite. It's more about, like, transforming job roles. Think about radiologists. They use AI to help analyze scans now.
Oh, yeah, I've heard about that.
So instead of having to look at hundreds of images manually, their job is becoming more about interpreting what the AI finds, making treatment decisions, providing that human touch that AI can't replicate.
So it's more of a collaboration than a replacement.
Yeah, exactly. It's about adapting to the new technology and focusing on the uniquely human aspects of care.
And like learning new skills to work alongside these AI systems.
Exactly. The article even suggests that medical schools should start teaching students about AI. So new doctors will be prepared to work with this technology from day one.
That makes sense. But what about doctors who are already practicing? How do they keep up with this AI revolution?
Training, professional development. Hospitals and healthcare systems need to invest in helping their staff adapt.
It's like we need to empower healthcare professionals to see AI as a tool that can make them better at what they do.
That's it, exactly. And don't forget, AI is also creating new jobs.
Oh, right. Like in AI development and data analysis.
Exactly. So it's not all about job losses. There are new opportunities emerging too.
It's like this whole new industry is being created around AI in healthcare.
Yeah.
So it's this like give and take, right? Jobs are changing, some might disappear, but new ones are being created too. But overall, the idea is that humans and machines are going to be working together.
That's the vision, yeah. It's not about replacing humans. It's about finding the best way for humans and AI to work together.
To create a better healthcare system for everyone.
Exactly.
Okay, but we keep coming back to this question of like, how do we make sure AI is used ethically, responsibly, as it becomes more and more integrated into healthcare?
Right, that's the big question.
How do we ensure it's actually benefiting patients and not like causing harm?
The article talks about this idea of human-centered AI.
Human-centered.
Yeah, it means designing and using AI in a way that puts human values first.
Yeah.
Well-being, autonomy, those kinds of things.
So it's not just about what AI can do, it's about what it should do.
That's it. And we have to be realistic. There are going to be growing pains as we figure out how to incorporate this new technology into healthcare. It's a complex system, right?
Yeah, healthcare is super complicated. So what can we do to make this transition smoother? Like, are there specific steps we can take?
The article has some suggestions. Like, we need clear laws about data sharing, a consensus on the big ethical questions around AI, and collaboration between, like, healthcare people and tech people.
So a lot of different stakeholders coming together to figure this out.
Yeah, it's a big team effort.
Yeah.
And we need to address those job displacement concerns head on. We can't just ignore them.
It's like we have to acknowledge the potential downsides and figure out ways to mitigate them.
Exactly.
But the payoff could be huge.
Huge. We could end up with a healthcare system that's not only more efficient, but also fairer.
More equitable for everyone.
That's the goal.
Okay, wow. We've covered so much ground here. It's been a really thought-provoking conversation. I feel like I have a much better understanding of the complexities of AI in healthcare now. It's not just about the technology itself, it's about all these other factors like ethics, regulations, and how we prepare the workforce.
You got it. It's this whole ecosystem.
Exactly. What do you think, what stands out to you as the most important takeaway from this discussion?
Honestly, it's the speed of it all. This technology is evolving so fast, it's, like, hard to keep up.
I know, right? It seems like every day there's something new happening with AI. And it's not just healthcare, it's everything.
Exactly. So it makes these conversations even more important. We can't just be reactive. We have to be proactive about shaping how this tech is used.
Totally. And that's a big theme in the article, too. Like, we need plans and strategies, not just for adopting the tech, but, like, integrating it thoughtfully into the way we already do things in healthcare.
Right. It's not just about the shiny new AI. It's about the people and the processes, too. Exactly. It's about the whole ecosystem. We need to create a system that blends AI with human expertise, but, like, always keeps the patient's needs at the center.
Yes. The patient should always come first. And that makes me think about, like, access. We have to make sure that these AI advancements are available to everyone, not just, people who can afford it.
Oh, definitely. The article talks about that, too, like how AI could actually make healthcare disparities worse if we're not careful.
So it's like we have to be intentional about equity right from the start.
Absolutely. Can't be an afterthought.
And that brings us back to like the bigger picture, right? This isn't just about technology, it's about society.
It is. AI has the potential to reshape so much of our world, not just healthcare.
Okay, so we've covered a lot, the possibilities of AI, the challenges, the ethical stuff. It's clear that AI is already changing healthcare in profound ways.
And it's only going to get, more impactful.
For sure. But as we move forward, I think the key takeaway is this. AI is a tool.
That's a good way to put it.
It's up to us to decide how we use it.
To shape the future we want.
Exactly. We need to be aware of both the potential and the risks.
And proceed thoughtfully, carefully, always putting the human element first.
Couldn't have said it better myself. Well, this has been a fascinating deep dive. I think we've given our listeners a lot to ponder.
We have. AI and healthcare, it's a complex topic, but hopefully this conversation has helped shed some light on both the opportunities and the challenges.
Absolutely. We've seen how AI can revolutionize diagnostics, improve efficiency, even personalize preventive care. But we've also discussed the ethical questions, the risks, and the need to be proactive in shaping how this technology is used.
Right, it's not a simple issue. There are no easy answers.
But one thing's for sure, AI is here to stay. And it's up to all of us to make sure it's used for good.
To create a healthier, more equitable future for everyone.
Well said. Thanks for joining me on this deep dive. It's been an enlightening conversation.
It has. Thanks for having me.